All right, here we are live on Facebook for another Monday. I am Daniel Tribby alongside Dr. C. How we doing today, Doc?
Good. How are you?
Doing good, doing good. So we've got some hip related fun to talk about today, right?
Yep.
All right. Well, before we do that, and we'll let everybody know, we are the owners at Regenerative Sports Spine and Spa. We specialize in non-surgical orthopedic care, if you will. So everything bone, muscle, joint, spine, we do without cutting. So we firmly believe in the body's unique ability to heal itself. And today we're going to talk about the body's natural healing ability, how we can harness that, and then use it to help heal your hip issues. So let's talk a little hip fun, Doc. What are some major hip issues that we see a lot that a lot of people deal with?
First, I mean, it's like arthritis is probably the top one, or you know, joint space narrowing, cartilage tears, which are in the hip are called labrum tears, bursitis. So that's probably the main few that
Yeah,
we have. Mhm.
I would say those are the top three. And usually, what you see is people having issues with like osteoarthritis, right? Which means there's so much wear and tear to the joint that now we got a bunch of bone spurs. Like that's the body's response to trying to heal a damaged area. Is it lays down more and more bone spurs, more bone growth to try to, you know, beef up that area, if you will. And the one that does that, it actually causes more pain in the long run. So, if any of you watching this have had issues with bone spurs or osteoarthritis in your hip, feel free to drop some likes and some loves there in the comment box, or give us a little comment there or question. I'd be happy to answer those for you in relation to that. But usually, what's the fix for that? If you have osteoarthritis in your hip, you got a lot of degrading, a lot of stuff going on, and people are going to do what? Steroids, physical therapy. Like, what's the common place, the common treatment?
Well, you first start with physical therapy, and some people do steroid injections as well at the same time.
Hmm.
And then after that, it's pretty much surgery. So it's like there's not a lot of options with the hip, unfortunately. But the other thing to keep in mind is, a lot of people call hip pain, what they actually call hip pain stems from the back. So there is separate back pain that causes hip issues, and then there's actually separate hip joint pain as well. So
Right.
it's not all, what you're saying hip pain may not actually be from your hip. So it's important to go get that checked out first. Make sure it's actually from the hip joint and not the lower back spine. So,
Yeah. So a lot of times people have SI joint issues or problems back there that can cause hip pain, so to speak. We're firmly talking about the ball as it fits into the socket in your hip today. So we have talked about hip. Yep, that's right there. So we have talked about back pain and its influence on hip pain today, where the focus is just on that joint right there where that ball fits in the socket. So yeah. So with the osteoarthritis, once you've done the steroids,
right.
which the problem with the steroids is that the more you have them, the more degradation of the joint that you actually do, right? There's some recent research that says the more steroid injections you get, the more you're actually potentially damaging the cartilage over time, right?
Right, exactly. So the cartilage thins over time if you do more and more steroid injections. So you're actually promoting yourself into actually needing a joint surgery quicker than typically. So it's like it is actually it's a terrible thing because people rely so much on steroid injections because guess what? That's what's approved under insurance. Instead of actually doing things like maybe a platelet rich plasma that's going to be healthier for you and doesn't wear and tear on the cartilage,
Got it.
and then promote more surgery of the hip joint
Right.
later on.
Yeah.
So, yeah.
We're going to talk about, you mentioned platelet rich plasma. We're going to talk about PRP. We're going to talk about bone marrow and stem cell therapy here for the hip. So don't go anywhere. That's coming in just a second.
Right.
But first, once you've gone through your steroids and you've done your pain medicines and you've done the physical therapy, which we firmly believe in, like physical therapy is a necessary thing, the next option is usually a hip replacement, right? I mean, what else do you have? The pain's so bad, the cartilage is gone, you've got all these bone spurs, and now hip replacement happens. Can you bring up the model and show everybody watching us what actually happens in a hip replacement? What do they actually do?
Well, they take this whole ball out and this air, and then put a artificial ball and then a pin through this bone here. So it's a really big surgery. I mean, it's like it's not something to take lightly.
Mhm.
It
Yeah,
does.
it looks like a bent railroad spike, right? So with a ball in the end, it's all metal. So they
Yep.
cut the actual neck of the femur right there, where they cut that ball off, and then they hammer a brand new ball down into the bone. And if they do the full hip, like there's a partial hip and a full hip. A partial hip is just the ball or just the socket, and
Yep.
the full hip is going to be both. So
The
you have
actual
the
socket
metal.
too. Yep.
You get a metal ball and a metal socket. So you get a whole brand new thing, right? And a lot of times you hear this with people who, the elderly people who fall. And my mom fell; she had to have the hip replacement. Broke her hip. You hear that happen a lot for people who have like not osteoarthritis, but osteoporosis or osteopenia, those types of things. But this does happen from an arthritic change too, or just over time. You have this bone on bone situation, if you will. But if people would take a different approach earlier on when they first started having pain, instead of resorting to things like steroids, right, or medicines, or even arthroscopic surgeries, and do certain aspects, what we're going to talk about right now, of regenerative medicine, like the PRP or the stem cell therapy. Those can actually prevent to some degree the degradation, correct? Like this can help you avoid surgery. Am I wrong?
Right. Yeah, no, you're correct. It can, but it has to be at the right time. It's like if you're already bone on bone and, it's like there's no joint space remaining in that area, it's too late. So it's like stem cell therapy, PRP can't help at that point, especially if you have a hip joint that just doesn't move because it's bone on bone, right?
Right.
So if we catch it earlier when it's mild or medium level arthritis, then we can definitely do things like, if it's mild, even just a platelet-rich plasma, which is just growth factors and anti-inflammatories, can get in there and help with some of those symptoms. And then, it's like whatever minor areas that can get better, the growth factors can help. If you're at a, moderate level, the bone marrow mesenchymal stem cells can help with repair of, some of that cartilage, some of the, it's like some of the cushiony areas, and really do a lot of good, and then help prevent that surgery that you may have actually be able to prevent forever, but maybe a few years. So it just really depends. But it is
Right.
very helpful in these types of situations.
Right. Well, let's break down just really quickly the PRP, the platelet-rich plasma. We hear a lot of people, like baseball players on ESPN. You hear about them getting these PRP injections in their knee or not their knee arthritis, but their tendonitis in their elbow, their knee, those different areas, and it gets them back on the field, back to play a little quicker. And we're not injecting steroids, right? Because we found that if the more steroids we do, the more we weaken those tissues, and the more likely they are to tear them. Right. So the PRP we can use in the same fashion for your hip if it's early arthritis, or if you have bursitis, or some of those other things that you mentioned, like tendonitis, those things that happen inside the hip.
Right.
But if PRP actually comes from your own blood, right? So we
Right.
draw your blood, we spin it down really, really fast, and it separates into two layers. And this yellowish clear fluid is the PRP. And your blood has a really unique way of signaling healing in your body. That's what happens. You get a cut, you have all these little things that come help clean the cut, and then you have all these other little signal proteins that say, hey guys, come fix this. We got some repairing to do. So if you harvest that and inject it into an area that's inflamed or has arthritis, the idea is that you're supplying that area with a concentrated dose of healing factors, right? Or signals that can heal. The
Right.
blood itself does not have stem cells in it when you get to a certain age, right?
Right.
There's not any, when you're over the age of 25, you're pretty much stopped growing. So there's no more active stem cells in your blood. So if anybody's feeding you that, don't let them feed you that. It's trash. All right. You can get really good relief from inflammation and very, very mild arthritis from PRP. But if you have some more osteoarthritis based or some serious cartilage issues, you're going to need to go into that stem cell world. And for us, we firmly believe in bone marrow and getting bone marrow from your own body. So, Doc, give us the skinny on bone marrow coming from your own body and why it's such a plentiful source of stem cells and other healing factors.
Actually, it's interesting because we have the hip here. This is where we get the bone marrow in our office. So this area, that's where some of the bone marrow lives. And it has, growth factors and anti-inflammatories, kind of like the platelet-rich plasma, but it also has mesenchymal stem cells, which are essentially blank cells that can become what you need them to be and help repair some of the damage that has been going on. So let's say there's some wear and tear of the cartilage. It can help that become more healthy. And then also, the inflammation, help that. And then any, ligament repairs, things like that. And it can help them be as healthy as possible. It's like we can't say that it repairs, fully or anything like that, but it helps that area become as healthy as possible so that maybe we can avoid that surgery forever or for a few years, especially in that hip area. So it's really potent cells that can give you some of the relief that you need, and also to get back to your activities. There's a lot of people with hip pain that can't run anymore or can't play a sport anymore. And if we can get these cells in there and then help that out, then maybe you can get back to your sport or the activity that you love, right?
Yeah.
So
Unless you're somebody like Bo Jackson, you're not going back to that sport after you have hip surgery, right? You're not going back after you have that replaced. You're not going back to that. Like very, very small percentage of people who have this surgery go back to that. So, and if you have questions about the PRP or the bone marrow stem cell or hip pain as it relates to, drop them in the comments. I'd be happy to address those. We'll pop them up on the screen and talk about them. But with the stem cells, right, we're taking this concentrated dose again from your bone marrow. And why the bone marrow? Well, because as we get to a certain age, the stem cells go dormant, and that's where they hide. They're inside bone marrow, predominantly in the hip and in your skull, which we're not going to go here to get bone marrow. It's kind of a dangerous area to claim. What's that?
And the tibia.
Yeah, tibia. Sorry. Tibia sounds a little bit painful to tap into, but so we get a plentiful source from your pelvis, and so we just tap in there, pull it out, filter it through, and then we go inject it directly into the surface where you need it, right? Like we don't want to just pop the needle in there and just shoot everywhere into the joint, right? Like we want to make sure that we have MRIs beforehand and we're placing the stem cells directly where you need them, right?
Right, absolutely. The direct injections get the best results. If you're just blanket doing it into, other than the hip, if you're just blanket doing it into the knee without directing it to where, let's say cartilage tears are or the damage is, then and it'll still help, but it's not going to help as much as if you really inject it where the problem is. It can really direct the repair that it's trying to make. So, yeah, absolutely.
Very good. And then when people have this, what's that procedure look like? We do everything in our office, right? We don't send anybody to the hospital. You have to go through that mess. So what does it look like in our office? How long does the procedure take?
It's about an hour and a half total. So we come in, we do partially sedate you, so you'll have an IV, and then just like we were talking about, it's like we go into this area, and then put in a needle in there, and it's not as painful as it sounds. I numb this bone up quite a bit, so you really don't feel much. Actually, most of the people feel the bone marrow pull when I take it out. Other than that, it's really not that painful. And then spin it, and then we don't do anything else to it, and then re-inject it to the area of damage, and that's it. So it's like typically if we're going to do a hip joint, I'll do multiple areas because we just really want to make sure we get everything. So it's like I'll do bursa area into the joint and into whatever cartilage area that may be damaged, and then go from there.
Perfect. And then what's the downtime like? What do we recommend people do after having this kind of procedure to help with their hip pain?
Downtime is usually 2 weeks. Just make sure that the cells stay in that area as long as possible, and then slowly get back into some activities, high-level activities. We may wait a little bit longer. Like running and things like that. But other than that, it's really minimal downtime. Just take it easy for a little while. Yeah.
Right. So you've got hip replacement surgery, which equals hospital stay, big surgery, potential for a lot of things to go wrong. Walker, in-home therapy, maybe even in-hospital therapy for a while, followed by 3 to 6 months of therapy in another facility, right? So you're talking about a really long-term type of healing process if you've waited to this point to now do something about your hip, right? Versus this is we're not taking you out of your activities. We're not putting you into a hospital, right? We are using the natural healability of your own body to hopefully correct some of this arthritic damage that's happened to your hip. And you're not missing loads of work. You're not having to do 17 hours of physical therapy a day, right, to get yourself back into shape. But we do believe that you should take on physical therapy, right? Like this is something you should do after this procedure. It's not like oh, the magic shot. I know we all want instant gratification. We want to feel better immediately, which is what steroids do for us. But if we're going to do something that actually has longevity to it, right, and we want to make the area conducive to healing, we want to do all the things that we can do to make sure it's strong, that we're not continuing to just break that hip down further.
Right.
So if we're going to go, what's the long term, like what does this look like from a healing standpoint? Like, from I have the procedure, how long is it going to take for me to start seeing benefits of this? If I'm doing physical therapy and doing all the things that's recommended, how long before I start seeing positive change?
Most people tell me they start feeling better about a month, and then continue to get better, because this is a repair cycle that it takes maybe 9 to 12 months, that continuous repair. However, most people feel pretty good around 2 to 3 months, and so they're able to do pretty much what they want to do. So it's like the downtime is so much less while you continue to get repair over time. These cells kind of stay in that area that you inject and then do their job for a while, so which is pretty cool. Daniel, how long did it take your mom to get back to her activities?
Oh, dear God. So my mom had, for those of you who are just joining us, my mom did break her hip, and she fell and broke it. And so she had to have the replacement surgery. And I mean, you're talking about a week in the hospital from the night she broke it to the time she got surgery and got released. Then she spent, I think, a week or two in an outpatient hospital where they do all the rehab stuff and get her back to walking and standing and all the things. And then came home, did in-home therapy, and then had to go to a facility and do therapy there afterwards. So you're talking about a really long process to get her back. Now she's got some other comorbidities, the rheumatoid arthritis, that kind of stuff that kind of play a part in that. But it was close to a year before she felt 100%, right? Or at least able to do all the things she wanted to do.
I thought it was about 9 months at least, right?
Yeah, and that's a long process, right? I mean, and she's doing well. She didn't have any problems with it, but you're talking about a year of her life that was severely changed because she had to have this hip surgery. Now, granted, hers was a traumatic experience, and hip replacements do better than any other joint replacement out there. Like, let's not poo-poo it. If you have to have it done, you have to have it done.
Right.
But do you really want to give 9 months of your life to something like that when you don't have to? You don't have to stay out of work. You don't have to stay out of in the hospital. You can drastically change the way your body functions and the way you heal simply by tapping into a natural source within your own body.
Right. Absolutely. So if it's, and I'll let you know. I mean, it's like, we'll come do a physical exam and see how you're doing. And if it's possible to actually help you, then I'll let you know. If not, if I recommend surgery, I'll be like, yeah, definitely you need surgery. So this isn't going to help enough. Right. So absolutely. That's definitely something to consider.
Yeah. And then really quickly before we end this, we usually try to keep these under 20 minutes, but if you have any questions, drop them in there. We'll answer them for you either now, or if you're watching this after the live, we'll come back and answer them. But last little pertinent point here, there's a lot of integrative medicine offices, we'll call them, that are offering stem cell therapy that's not coming from your own body. It's a donated source, right? Amnion or Wharton's jelly or this umbilical cord stuff. What do we need to let people know about that?
Well, actually, that is off the market now. So the FDA has basically said you can't use it unless it's part of a medical study. There's still ongoing studies. So as of right now, until the studies are done, and then there's full, it's like disclosure of all of the results and things like that. So that is really not allowed anymore. So so just be careful with that kind of substance.
Yeah. And that was the biggest reason was because it was being abused in offices where it shouldn't have been used, because these guys aren't qualified to pull bone marrow. So they're using other donated sources, calling it stem cell therapy, which it was not, charging an arm and a leg for it, getting paid and not getting results. So leave it to people to ruin something that could be a really good thing. But so why should people then come to an office like ours? What's the difference between what those people do, their specialty, and yours?
Well, it's like I've been specially trained in spine and joint procedures. I did an extra year of fellowship for that. And then the other offices typically had a nurse practitioner or a PA do it, who's had very minimal, maybe a couple of months of training and maybe joints, but they really it wasn't directed care either. It's basically generalized injections that weren't directed towards the problem. So you may not have gotten that much better anyway, right? So it's like generalized cells can help sometimes, kind of the difference between taking, let's say, oral steroids versus steroid injections. The reason why steroid injections are better because they're more localized. They are right in the area. So that's the same kind of thing. If you just do generalized muscle injections around the joints, around the spine, you're not going to get as good results. It's like, so we do directed care right where the problem is. And so that's why you get better results typically.
Great. And how many of these non-surgical injection type procedures have you done in your career?
Well, now you're asking me to date myself, but it's been about 20 years. So I don't know, over 20,000 at least. I've lost count. So
yeah, that's a lot. That's a lot. So if you're in the greater Orlando area, or even if you're not, we would love to be able to help you with your hip issues. If you're in the Orlando area, we're in Lake Nona, just outside the airport. If you're outside wanting to come into town to get the specialized care that we offer, we do have a really unique VIP package that includes your airport transport, a place to stay. You get transport to and from our office. You get to stay in a place where food and everything is accessible to you. So we make this super easy for you. You just got to get here. So if that's something that interests you, definitely click the link in our Facebook. You can call us, make an appointment, check us out on the webpage, and request one online. We would love to be able to help you with your hip issue. And again, if you have more questions, drop them in the comments. We're happy to answer them for you either in the next couple seconds or post live. We'll go back and answer them later. So other than that, well, thanks to those of you who tuned in and listened to us talk about hip osteoarthritis and why to avoid steroids and surgeries. And we will be back again next Monday. We're here every Monday around lunchtime, East Coast time. What are we going to talk about next week? What should we drop in here for everybody to listen to next week?
Are we going to get on July 4th?
Oh, it is July 4th. Well, never mind. We'll see you guys in 2 weeks then. Enjoy your July 4th. Have a great holiday, and we'll see you guys in a couple weeks then. And take care of your hips, backs, necks, all the things. And if you need help, again, we're here. Click that link. Come see us.
All right.
All right.
Bye.
Bye.
Bye.